My name is Dr. Belinda Stella. I am a gynecologist at the Muhimbili University of Health and Allied Sciences in Tanzania. I've been practicing as an obstetrician and gynecologist for quite some time now, almost 8 years. Tanzania is one of the countries that has a bit high maternal mortality and neonatal mortality. So in a place like this, problems like infertility tend to be forgotten because most of the time people think because you have very high problems related to maternal mortality and neonatal mortality, then all the sort of efforts are kept on trying to reduce that. So infertility gets forgotten. In Tanzania, we have a couple of challenges with in relation to infertility treatment. We first of all do not have enough experts. We have very few people who have been trained in infertility management, especially assisted reproductive technologies. We have almost like 7 in the whole country. Tanzania is a big country. We have almost like 55 million people in the whole country, and we have just like 7, and most of these are young ones who have been trained just recently. I know a few of them that provide these services. They're very expensive, and majority of the population who need these services cannot really afford to pay for these services. So they tend to not be able to get children using the assisted reproductive technology. In terms of perception in the community, especially social perception, a woman, for most, they think that the sole purpose of being a woman is to be able to bear a child. So once you are not able to bear a child, you are regarded as being sort of useless, or there is a sense of feeling incomplete. So we have two sides of the coin. There is a few who will be okay because they know that a child is a gift from God, and once a person is not able to conceive, then it's not really their fault, and they will be able to support this couple. But the rest, which is the majority on the other side of the coin, they will tend to blame the women that maybe they were involved in some things in their past that made them not be able to conceive this time. Or it's because maybe just they are cursed or something like that. So many of them are divorced. If they are not divorced, they will be treated unfairly in the families, especially sometimes from the husband himself, sometimes from the relatives of the husband. I'm talking especially about the mothers and the sisters. Some would even go to tell them like, you are here, you've been married, you're just eating and going to the toilet and not producing any child, not bearing any child. So you are useless, things like that. And these things really can bring the esteem of a person very much down, and it makes them even not be able to do even their normal day-to-day activities. And some of them, you may find that they are not even able to take care of themselves. Maybe they are not very much educated, or they don't have a job and something like that. So they are totally dependent on the husband, and this makes the abuse even worse. The Merck Fertility Training program is very important. For me, it has given me an opportunity to be trained in a very prestigious fertility center under the supervision of very experienced fertility specialists. And in so doing, I've been able to gain a lot of knowledge in assisted reproduction, but also skills. I'm going home with a lot of new knowledge and skills that I'm going to put into practice. Now this is going to help my patients a lot, because now the services that I'll be providing will be better in terms of the quality. I'm not afraid to say that I have seen a lot of changes in the way that I used to previously manage patients with infertility. And the things that I have learned here is going to improve the services that I'm going to be giving to the patients that I'm going to see. So these patients now will have a chance to be managed with a person who has been trained, so the knowledge is increased and the skills as well. They will be able to fulfill their dreams, God willing. And I have also learned something about individualizing patient care. Not only to just look at a person depending on the problems that they're having, but also their economic situation, their social background. And you take all of this into consideration when you are planning a treatment for a couple. My plans when I go back are mainly like three. First of all, it's service provision. I have been seeing patients already for quite some time. So I'll go back again and I'll continue to see patients. So I want to use the knowledge and skills that I have gained to the patients that I'm going to see that need infertility treatment. So I want to up my service provision in terms of management of infertility. And two is in the area of training, because I believe there's a lot that I can share with the rest of the doctors back in my country and be able to give more quality treatment for infertility. So I will be able to share this knowledge with the rest, and together we can increase the quality and even the access to infertility treatment. Because if we are many of us who are able to do this, it means that the patients will have a lot of doctors to go to, not just Dar es Salaam, even the regions outside Dar es Salaam. And the third thing will be in community awareness. I believe there's a lot to be done to increase awareness about infertility as a condition, as a disease, but also the causes of infertility. If some can be, for some of the things that can be avoided. I believe this is going to change the dynamics and reduce the stigma as well that is associated with infertility. To the new doctors who will get this opportunity to come here, I would say the 3 months that one is going to spend here, they are very useful and valuable if you know what you want out of something. So if you can set your objectives right, and once you're here, you know what you're here for, then this is a very good opportunity to learn about assisted reproduction. I would like to also take this opportunity to thank Merck Foundation through the Merck Fertility Training Program, because without this opportunity, then I would not have had these 3 months where I got to learn everything that I learned. I would not have a chance to get these collaborations that I had with the people of Milan Hospital. So really, I would really like to thank Merck Foundation through the Merck Fertility Training Program for this opportunity. It has been a tremendous opportunity for me, and I'm proud to say that through this training program, I will be going back home being a better fertility specialist than I was before.